the sea. For more details, here's firing back at tabloid attacks on her 25-pound weight gain. Lady Gaga posted pictures of herself wearing only bra and panties on her website Tuesday. Gaga says she's battled with anorexia and bulimia since she was 15. Now, she's celebrating her so-called curvy flaws in a blog entitled A Body Revolution 2013. On the site, Lady Gaga invites fans to post their own photos in an effort to make their flaws famous. In the art playtext, we're getting local reaction to Gaga's campaign and how people here handle the daily struggle to stay in shape without compromising their health. This is Paula Boom Boom reporting for the 11 a.m. edition of Come to 10 Star Checkup. Back to you, Irene.
Nagbago ka ba ng ketchup?
Bakit?
Ang sarap eh.
Ang number 1, lalo pang pinasarap, bagong UFO Banana Ketchup. Ngayon, gawa na sa precious spices kaya mas buhay ang tamis anghang sa bibig.
Sa ketchup lang ba to? Gumaganda ka lalo.
Bagong UFO Banana Ketchup, mas buhay ang tamis anghang.
Gutom lang yan.
Oo nga. Ako rin. Gutom na gutom din.
Nagugutom yan. Kasi daliri ko kinain mo.
In today's Star Checkup, our resident physician, Miss Grace Liban, will talk about anorexia and bulimia.
Anorexia and bulimia are probably the most familiar types of eating disorders, but they are not the most common. Some 50 to 60% of patients don't quite make the cut to be diagnosed with full-blown anorexia or bulimia and are instead classified as having an eating disorder not otherwise specified. But this group is so vast and the cases within it is so diverse that many in the field believe it creates more problems than it does solutions in terms of treating patients and understanding the syndromes. People lumped into this unspecified group can also have misperceptions about their condition, thinking it is not as serious as anorexia or bulimia. But in fact, recent studies have found that there really isn't a medical difference between the three recognized types of eating disorders. Now, physicians and psychiatrists are taking action to remedy the situation. They are proposing revisions to the Psychiatric Bible, the Diagnostic and Statistical Manual of Mental Disorders, or DSM, for the newer version, to be published in 2013. The suggested changes include relaxing the strict criteria for anorexia and bulimia somewhat and giving other conditions such as binge eating their own official labels. These more specific labels could be a boon to treatment and the mental health of the patient, who will finally know what he or she has. In addition, experience has shown that when a disorder gets a name, more research and attention is paid to it. Even so, some experts are insulted, saying these DSM changes won't make any real difference as far as treatment goes. At the moment, it's like a housekeeping job. We're just trying to make it tidy. And that's good in the sense of nicely sort of putting people into different drawers. If you like, it's tidy, but it may be meaningless. Currently, the diagnostic criteria for anorexia and bulimia have not been decided based on evidence. They've been decided based on expert consensus. And that is valuable. I don't discount that at all, but I think now that we are starting to have more evidence, we should consider using that evidence to really reshape this criteria.
Nalaman mo na bang mapapag-aral ka niya?
Tutulungan tayo para magkatrabaho at ang kanyang plano ay magkapal tayo. Si Bilyang ang tunay na mahirap. Si Bilyang ang tunay na may malasakit. Si Bilyang ang may kakayahan. Si Johnny Bilyang ang magtatapos ng ating kahirapan.
confidence in front of the camera could not protect her from the inner, lasting effects of childhood bullying.
I've spoken openly about being bullied for the past few years, but one thing that I've never been comfortable talking about was the effects that it had on my life afterwards. I literally didn't know why they were so mean to me. And I would ask them why, and they would just say, well, you're fat. I developed an eating disorder, and that's the kind of what I've been dealing with ever since. I was compulsively overeating when I was 8 years old. So I guess for the past 10 years, I had a really unhealthy relationship with food. It was a way of expressing my own shame of myself and of my body. I was matching the inside to the outside, and there were some times where my emotions were just so built up and I didn't know what to do. The only way that I could get instant gratification was through an immediate release on myself. I was performing on concerts on empty stomach. I was losing my voice from purging. I was self-medicating. I was not taking medications for depression, and I literally was so emotionally whacked out that I took out on someone. I take 100% responsibility. I feel horrible. She was my friend. They sat me down and said, "You can't live like this." For the first time in my life, I started to feel. A picture of my little sister on my bulletin board was one of the main things that kept me going. The real reason why I'm sitting down with you is to open up the eyes of the so many young girls that it doesn't have to be this way.
Again, this is Paula Boom Boom reporting for the 11 a.m. edition of Come to 10 Star Checkup.
Now, there's a spin to the sachet you know. No Chose Up Twist Top. It has a resealable cover that lets you use it anytime, anywhere. A fresh twist on closeness.
Ibang klase talaga tong Joseph Twist Top. Biruin mo, nakaabot tayo sa outer space.
Oo nga! Ang sosyal naman natin. Dito ba tayo magtutoothbrush? Lika na! Mag-toothbrush na tayo.
Yeah.
Uy!
So, partner, why do you think that most of our celebrities have this disorder?
Well, I guess it's because of the pressure brought about by their work. I think most people nowadays are so conscious about their bodies. That's why they tend to overreact when they get fat. Most people think that if you're slim, then therefore you're pretty or you're sexy, like that.
Yeah, and I don't think that being fat is not being pretty. So guys, if you're fat, don't get upset and just be proud of yourself.
This is real, this is me. I'm exactly where I'm supposed to be now. Gonna let the light shine on me. Now I'm found.
Okay, that was Demo Lovato over there. And so that's all for today.
Tune in for tomorrow's Star Checkup for the latest check updates on the health status of your favorite stars.
Okay,